Good evening, Dr. Phil here. Today we'll be discussing on myocardial blood supply part 1. Introduction. The coronary circulation consists of blood vessels that carry blood to and from the tissues of the heart. The blood flowing within the cardiac chambers do not nourish the myocardium. The functional blood supply that oxygenates and brings nourishment to the heart is provided by the right coronary and left coronary artery. It is not always possible to diagnose the site of coronary artery occlusion from ECG or echocardiography. This is because there is a considerable overlap in arterial supply to different areas of the myocardium. However, the coronary artery most likely associated with an infarct in an anatomic region of the heart is as follows: inferior infarct, right coronary artery; anteroseptal infarct, left anterior descending artery; anteroapical infarct, left anterior descending artery, distal portion; anterolateral infarct, circumflex artery from the left coronary artery; and posterior infarct, the right coronary artery. The major coronary vessels lie in several grooves or sulci on the surface of the heart. The coronary sulcus, also known as the atrioventricular groove, it runs obliquely around the heart, separating the atria from the ventricles. It is deficient in the front, where it is crossed by the root of the pulmonary trunk. It is divided into the left and right coronary sulcus. Contents: for the left coronary sulcus, the circumflex branch of the left coronary artery and the coronary sinus. For the right coronary sulcus, the right coronary artery, small cardiac vein, and posterior descending coronary artery in 90% of people. The anterior interventricular sulcus, it runs on the anterior surface of the heart, extending from the coronary sulcus towards the apex of the heart. It lies between the right and left ventricles and contains the anterior interventricular artery and the great cardiac vein. The posterior interventricular sulcus runs on the posterior surface of the heart, extending from the coronary sulcus towards the apex of the heart. It lies between the right and left ventricles and contains the posterior interventricular artery and middle cardiac vein. Origins of the coronary arteries. The coronary arteries branches out from the base of the aorta. The right coronary artery originates from the anterior aortic sinus of the ascending aorta. The left coronary artery originates from the left posterior aortic sinus of the ascending aorta. No vessels arise from the right posterior aortic sinus, therefore it is known as the non-coronary sinus. The left coronary artery. It arises from the left posterior aortic sinus of the ascending aorta. It is larger than the right coronary artery and carries more blood. It passes between the left atrial appendage and the pulmonary trunk. Major branches includes the anterior interventricular artery, also known as the left anterior descending artery. This artery passes down the anterior interventricular groove to give off anterior ventricular branches. The anterior interventricular artery anastomoses with the posterior interventricular artery from the RCA at the apex of the heart and continues to the posterior wall. It supplies blood to most of the anterior part of the heart. The left marginal artery supplies blood to the lateral wall of the left ventricle. The circumflex artery continues in the atrioventricular groove to anastomose with the inferior interventricular artery at the posterior side of the heart. This artery supplies blood to much of the posterior wall of the heart. The left coronary artery supplies the left ventricle, the left atrium, part of the interventricular septum, the sinoatrial node in 35% of people via the circumflex branch, the atrioventricular node in 20% of people via the circumflex branch, and the conducting system in 20% of people. The endocardium, the innermost part, receives oxygen directly from blood flowing within the ventricles. This is a left coronary arteriogram viewed from a right anterior oblique direction. Structures shown here includes the catheter, left coronary artery, anterior interventricular branch, the circumflex branch, the left marginal branch of the circumflex, septal branches, posterior atrial branch, left posterolateral branch of the circumflex, posterior ventricular branches, posterior interventricular branch, and the diaphragm. The right coronary artery. It arises from the anterior aortic sinus of the ascending aorta, and it passes between the pulmonary trunk and the right atrial appendage. It descends in the anterior atrioventricular groove. Major branches includes the right marginal artery, the posterior interventricular artery, atrial and ventricular short branches. The right marginal artery lies at the inferior border of the heart. It travels along the right ventricle towards the apex and supplies blood to the lateral wall of the right ventricle. The posterior interventricular artery continues in the groove of the same name. It anastomoses with the circumflex artery and the anterior interventricular artery and supplies blood to the posterior and inferior part of the heart. The right coronary artery supplies the right ventricle and the right atrium, part of the interventricular septum, the sinoatrial node in 65% of people, the bundle of His, atrioventricular node in 80% of people, the conducting system in 80% of people, and a small diaphragmatic part of the left ventricle. This is a right coronary arteriogram viewed from the left anterior oblique direction. Structures shown includes the catheter, sinoatrial node branch, conus arteriosus branch, anterior ventricular branch, right coronary artery, anterior ventricular branch, the AV node branch and the posterior ventricular branch, the right marginal branch, the posterior interventricular branch, the posterior septal branches, and the diaphragm. Anastomosis between coronary arteries. Most of the myocardium receives blood from more than one arterial branch. The coronary circulation has many direct connections between arteries, known as anastomosis. These anastomosis may form between branches of a given artery and branches of different arteries. Anastomosis permits continuation of blood supply to certain areas via other arterial branches if one arterial branch is blocked. Increased aerobic exercise causes increased density of blood vessels supplying blood to the myocardium, increase in number and extent of the anastomosis, and increased chance that a person will survive the blockage of a small coronary artery. However, the blockage of larger coronary blood vessels still has the potential to permanently damage large areas of the heart wall. Venous drainage of the myocardium. Venous drainage from the heart returns to the circulation via the coronary sinus and the venae cordis minime. The venae cordis minime is a network of small veins. Up to 1/3 of cardiac venous blood drains directly into the cardiac chambers via these small veins. Regarding larger veins, the coronary sinus is a large venous cavity located to the left of the opening of the inferior vena cava. It lies in the posterior atrioventricular groove and empties into the right atrium. 2/3 of cardiac venous blood drains via large veins into the right atrium via this coronary sinus. Larger veins tend to accompany the coronary arteries and includes the great cardiac vein, middle cardiac vein, small cardiac vein, oblique vein, and anterior cardiac vein. The great cardiac vein is formed from the anterior interventricular vein. It lies in the anterior interventricular groove with the LAD. It gradually enlarges to form the coronary sinus as it courses in the coronary sulcus. It receives the posterior vein of the left ventricle and drains blood from the left side of the heart. The middle cardiac vein lies in the inferior interventricular groove, which contains the anastomosis between the inferior interventricular and circumflex arteries. The small cardiac vein accompanies the marginal branch of the right coronary artery and drains the right margin of the heart. The oblique vein lies on the posterior surface of the left atrium. The anterior cardiac vein lies with the right coronary artery in the anterior atrioventricular groove and drains directly into the right atrium. These are my references. Thank you.